I'm Melanie Brim, President and CEO of Michigan Health Council. We're talking about the power of understanding, which is a health literacy program that we've established to help organizations address some of the challenges associated with low health literacy levels. There are several factors that make up health literacy. It's the ability that people have to take in information, process it, and use it to make decisions about their health care. Health literacy challenges might be things like not being able to read or not read well, not be able to work with numbers very well, ability to write. There are also cognitive changes that come with aging that make those skills even harder to apply. So through the power of understanding, we teach healthcare providers how to recognize and work with patients to make sure their communications are clear. One of the things that's important about health literacy programming is that we want to reduce the possibility of stigma and shame. So one of the things that we say all the time is it's on the provider. In the power of understanding, we're not trying to fix patient literacy levels. We are trying to teach providers, healthcare providers, how to communicate in a way that they are sure that the patient is understanding what they are saying. So the burden is on the provider, it's not on the patient. They use a technique called teach back, where we explain in plain language what we're trying to communicate to the patient. We ask the patient through specific kinds of questions to tell us what they've just heard from us. I want to make sure that I have communicated this effectively with you, as opposed to putting the burden on the patient to understand. And if the patient can't provide that information back clearly, correctly, then we reteach it in a different way. And we continue to do that until we're sure that the patient is walking away with a thorough understanding, whether it's how to take a medication, how to change a bandage, whatever instructions we've needed to convey, even understanding their diagnosis. We do that, again, with the onus being on the provider. We encourage the use of universal precaution, which is to say, let's work from the assumption that everyone would benefit from our using plain language. Everyone would benefit from our repeating back instructions and making sure through teach back that they understand, rather than having to label someone, having low literacy. And so if we use general standards for plain language, use the teach back method with everybody, then we don't have to actually identify specific people who have literacy levels. We just use universal precautions, approach our communications and interaction with patients in the same way, and that way everyone is treated equitably in terms of how a provider is interacting with the patient. Within the Power of Understanding curriculum, one of the other pieces we focus on is understanding how patients prefer to learn. Some people prefer to learn by reading. Some are auditory, that is, they learn better by hearing it. And some people learn better kinesthetically, being able to actually do something, demonstrate it. And so one of the things, along with plain language and teach back, we also want to make sure that we take time as a provider to try to figure out how best our patient is interested, how best we can provide them the information. If we understand that, we can, again, it adds to our ability to be effective in our communications when we understand how best they learn. So another aspect of the power of understanding is evaluating patient education resources that are used to help educate patients around their diagnosis or particular care instructions that they're supposed to follow. As part of the Power of Understanding, we will assist an organization evaluating and revising and making sure that their patient ed materials are all at appropriate reading levels and that they're culturally sensitive. The Power of Understanding is appropriate for all kinds of health organizations, nursing homes, hospitals, doctors' offices, really anyone who intersects with a patient around healthcare-related issues. We recently have been involved in a project with PACE of Southeast Michigan, and we have trained everyone from transportation drivers to the aides that work with the patients, all the way up through the top of the clinical staff. So anyone who has any interaction with the patient, there's always an opportunity to communicate more effectively, regardless of what information you're conveying to them.